Wonderful. Waiting for a bunch more. I know that one can't come. She emailed me, but let's get started. So everybody, thank you so much for coming. I'm really honored that you are here with us. It's a special group, and my beautiful friend here, Anna, Dr. Yusim, will be really inspiring us with not just her inner beauty and the grace that she has, but with such a backload of clinical knowledge that can help us move and transition from trauma into life. And before we get started, I just want to read Anna's bio for you so you have a really good context of where she's coming from. I met Anna through my radio show, and we've done a few things together, and there's an unending beauty in her and giving that is just, you'll get that resonation through this. And it's just such an honor for me to have Anna with us. And I think that you'll be honored to listen to her. So Dr. Anna Yusim is a world-renowned board-certified psychiatrist with a private practice in New York City. And she's the best-selling author of Fulfilled: How the Science of Spirituality Can Help You Live a Happier, More Meaningful Life. She is on the clinical faculty at Yale Medical School, where she is creating a mental health and spirituality program. Dr. Yusim completed her undergraduate education at Stanford University, where she studied biology and philosophy. She attended Yale Medical School and the NYU residency training program in psychiatry. She has traveled, lived, and worked in over 60 countries and presented at numerous national and international medical conferences. Dr. Yusim has published over 70 academic articles, book chapters, scientific abstracts, and book reviews on various topics in psychiatry. So Dr. Yusim, welcome. Thank you so much for joining.
Thank you so much, Kathy. It's a pleasure to be here with you.
You and I have talked a lot. Yes, and thank you everybody for coming. A lot of people have now jumped on. The reason that I wanted to have this webinar with everybody was because there is an innate sense for many people that once treatment is finished from cancer, you can just transition into normal life. And we're going to talk about normal life. But for many of us, that's not the case. So we need to address the emotions. And as Dr. Yusim will probably attest to, we can call this a trauma once we have finished our treatment. And, I just want to start off with a personal note. My name is Cathy Biase for people who are new to me. I am a cancer coach and a nutritionist, and my practice is here in Toronto. And I work mainly with people that are going through treatment and into prevention. And what I have seen a lot of is that when you get the trauma, so I shouldn't say the trauma, for everyone, we may not call that a trauma. When you get a diagnosis of cancer, even though survivorship is increasing year over year, for many people, the knee-jerk reaction is a look at mortality for the first time. And that can be something that can be overwhelming. But if anybody has been in the system with a diagnosis of cancer, you don't have a lot of time to deal with that mental piece, because once you've had a diagnosis, you go right into the medical system, and your treatment protocol, be it a year or longer, is filled with appointments, tests, results, treatments. And for many people, the way that you approach this and the way that I approach it is with head down, get through things, just get to the end of the treatment. And I don't think that that's wrong, Anna. I just think that what happens is that this whole mental space after treatment is not dealt with. It's like learning to ride a bike, and you've got somebody with you all the time, holding you there, holding you up, and then all of a sudden they let go and you're on your own. So this, what we're calling the healing space, is what I would really like us to talk about, and how important it is after an event like cancer that you do need to go back and deal with the emotions of the diagnosis and treatment in order to completely heal. What are your thoughts on that?
Yeah. And I think, Kathy, on so many levels, everything that you are saying is so right on. And in my practice as a psychiatrist, having seen probably close to 2,000 patients at this point over the last 15 years. A lot of people have suffered from cancer diagnoses and have successfully, recovered or been in remission from cancer treatment. And what you're saying is so right on. For a lot of people, it's actually interesting. It's the treatment, and when they know where they're going and what they're doing and have appointments and have their treatment team and have ABCD in terms of their schedule known and solidified, they actually feel much more in control of their life than when it's all over, when they're in remission, and then what? And then suddenly this space opens up in their life, and how do you fill that void, right? Do you return back to your normal life, or do you recognize that by virtue of this experience, you have become a changed person? With any experience that we have, we hope that whether the experience be positive, negative, whether there be trauma involved, whether there be growth and challenge, we hope that the experience will transform us, and that at the end of the experience, we actually will be a different, more evolved person than we will be at the beginning. And so what is needed for that growth and evolution, and what is needed to face the difficult emotions, Cathy, that you've been talking about, the fear, the horror, the helplessness, having to deal with one's mortality. So I think both you and I have a lot of thoughts, and we've talked a little bit about this. And I'm also, of course, I would love to welcome people's feedback and input and questions as well as we go through this.
Absolutely. So I do have the chat open. So if you have any questions that pop up, this is a very interactive. I really want you to get as much as you can from Anna. I know some people are still trying to go through this. I think, Anna, whether it be a survivorship plan or whether it be talking to somebody before the end of treatment, I think a plan put in place to bridge end of treatment to this transition into life is very, very important for me. There is a sense that your life is being controlled going through treatment, and then you are wanting to go back, as I say, to normal life. You need a bridge to get there. And I think maybe one of the things we should talk about is it a realistic expectation to go back to life as it was prior to a cancer diagnosis?
Right. And for every person, that is a different answer. For some people, the answer will be yes, I want to do that. I can do that. Not only that, it's the only thing that I want to do is I want to go back to life as usual. And moreover, it's going to enable me to appreciate and value and be grateful for the life I had in a way I never had before. And for other people, they are changed by this. Either they are changed in their sense of purpose and meaning in their life, and they're like, okay, you know what? This makes me realize facing my own mortality, having this diagnosis, it makes me realize that what I was doing either is no longer as meaningful or is not sustainable for whatever reason, whether I'm not feeling as well or I just want to do something that makes a contribution in a different way. And in that case, people choose not to come back to the life. And I've had many patients after a cancer diagnosis, they become advocates, they become writers, they become poets, they've started doing things, they've started, taking up archery, they've started doing things that they've always wanted to do, but never have for a number of different reasons. There's a lot of healing depending on the extent of your treatment that also has to take place. People have also changed their diets, they've changed their meditation practices, they become spiritual, they've discovered God. Some people after cancer, they're like, it was during cancer when I was being treated that I felt most connected to God. And now after treatment, I feel less connected. How do I maintain that connection again? And we explore as to why that was. And it's because they were praying every day. They were just very, very spiritually engaged in their healing process, in the way in which they were coming into the world and what they were receiving and what they were giving. And then we get back into the more non-cancer world, which for them was a more secular world. And suddenly that's gone. They missed the God they had discovered in the course of their treatment. Now, these are all generally very positive stories. It's hard. It's invariably hard because there's so many changes that are going on within a person in terms of your transformation of who you are and your own identity. There's nothing that changes somebody's identity as any kind of diagnosis, especially a serious diagnosis like cancer. And so a lot of people, they start taking on the identity of a cancer survivor. Look what I have been through. Look at the challenge I've overcome. Look at the strength I've gained through this. But then it's also possible to take on the other side, the victim mentality. Why did this happen to me? I'm doing everything to live a healthy life, and yet this still happened to me. And those are very natural, normal feelings in this process. And so, one of the questions, you and I are asking, Cathy, is how do we work through these difficult emotions, and how do we fill our life with as much positive affect as we can? Because it's been shown time and again that positive affect is what enables people to heal, to go into remission, and have a higher and better quality of life in through the process.
Well, let's talk about maybe steps to get into this process of healing. But before we do that, let's step back and examine what happens when you don't deal with these emotions, when these emotions are buried. What can happen to you mentally as well as physiologically if we are not attending that mental piece?
Mhm. Yeah, that's a great question, and I want to also uh, answer that question and highlight something that Deborah just shared with the group. She shared,
Mhm.
"I mourned and grieved over not being able to return to work more than I grieved about having a cancer diagnosis and ongoing meds." Thank you so much, Deborah, for sharing that. I
Mhm.
think you are not alone in that experience, and I'm sure people could relate to the grief and loss that comes with what it can, not the cancer diagnosis, but what it means for the quality of your life and what you're able to do versus not able to do. It's, a little bit like the pandemic. Something is suddenly, in some cases, not in all cases, taken away. And then you're like, I just wish I had the life that I had before. I love my life. I didn't even know I loved my life. But now that I don't have that life, wow, what a great life I had. And so grieving and what grieving the loss of whether it be your health or being able to work or the grief of what once was, all of that is a normal part of the cancer process. And then in response to your question, Cathy, what happens when we stop feeling those emotions? What happens when we stop grieving? What happens when we are unable to process and then we get stuck? And we can get stuck in certain emotions that perhaps have come up in the past and we were never able to process, or certain thought patterns that become obsessive and ruminative, and we just don't know how to break free. This is often when people come to me for professional help or some help with that. And those thoughts could be, why did this happen to me? Feeling victim mentality, not knowing how we're going to get out, the terror of what if I die? What about
Mhm.
the unlived life I have, or the loose ends I have to tie up? What about my children? What about my family? What did I do to deserve this? Or blaming oneself, blaming others, feelings of shame, feelings of doubt, feelings of guilt, all feelings. There's no right or wrong feelings when it comes to cancer. It's just all of it comes up. How do we metabolize those feelings? How do we
Mhm.
work through them to be able to not be stuck in them, but really use them as a force for our good and to metabolize them in the service of ourselves?
Having these emotions and becoming sick, I've heard this over and over again when I'm working with people. They feel that it's a weakness. And I'm here to tell you that I went through the same thing. And what helped me was to talk about things. When I started, after my cancer care, when I started doing this nutrition piece, I didn't want to be involved with cancer. I had no intention of going into the cancer space. And I honestly, to be totally frank, was embarrassed of my diagnosis. I was embarrassed of my scars. I was embarrassed that I felt that how did I allow myself to get cancer? It took a while. And I think people need to understand that it is a process. And I think one of the things, Anna, and maybe you can speak to this, is setting realistic goals emotionally. You know, someone who's had cancer, a lot of us who have had cancer, maybe start off thinking that we're just going to forget about it. It's done. And that may not be realistic for a lot of people. When I talk to people about my own feelings, and everyone's feelings are going to be different, I know that a tweak, an ache, and a pain, still sometimes my thoughts go to, is this cancer again? And I don't think there's anything wrong with that. I think what we need to do is learn how to deal with this. And I tell everybody this. You know, my husband said to me, "You're afraid of getting it back, and everybody else is afraid of getting it in the first place." And for me, that was a brilliant, simple statement. Um, but I don't want anyone to think of having cancer and going through treatment as a weakness.
Yeah. Yeah. And I think what you're saying about that and the feeling of shame and it's somehow a weakness or something's wrong with you. And this is, part of our society and the norms of our society where everything has to appear so shiny and rosy and perfect. And, this is really where we live and even on social media. And there are brave, beautiful souls like yourself, Cathy, who are able to put yourself out there and say, yeah, this is how I felt and this is what I experienced. And this is why I have not been diagnosed with cancer, but I recently had a dear cousin of mine die of cancer a week ago, relatively young, and it was ovarian cancer. So we've all been touched in some way, shape, or form by this. I mean, my equivalent of this was, our getting very severe COVID and my husband being hospitalized. Yes, it's not anywhere on the order of that, but I think it's so important for people to speak out about what they are feeling and about
Mhm.
shame and loss and guilt and trauma, and to realize that there is nothing of that this is just us human beings going through the human experience and doing what we can in this world to live the best life possible. The reality is that every one of us at some point in time is going to get sick and die, right? This is what happens to us. For some
Mhm.
people, it happens sooner. For some people, it happens later. And it's a sad reality, but it's also an existential truth. And the acceptance of that existential truth frees us. It frees us from having to get it all right. It frees us from having to be perfect all the time. It frees us to be able to accept life on life's terms. And when something like cancer comes, to be able to surrender to it and say, you know what? I can do this. This is okay.
Mhm.
Thank God that I have cancer at a time in the world where scientific advances are such that we can treat so many cancers in terms of Western medicine, but also in terms of all the complementary treatments that are available. And I'm going to do my best to not just go through this experience, but be present for this experience, surrender to this experience, trust in the process of life to have, maintain my spiritual center and know that on the other side of this, I'm going to do my best to have the best life possible and find the light at the end of the tunnel.
Do you think that spirituality, now this may be a question you don't want to answer, but do you think that spirituality should be part and parcel with an ongoing protocol in cancer? Do you think that this is missing? Maybe is what I'm trying to say. A missing piece to the clinical part of cancer and the integrative part of cancer. Working with someone through a diagnosis as opposed to waiting till the end. Is there a difference in outcome, do you think?
I think it's such a great question. And so let's talk about where spirituality shows up in medicine. Spirituality is part of the medical standard of care in two places in medicine. The first one is addiction treatment, because one of the medical standards of care for addiction treatment is Alcoholics Anonymous or AA, or the 12-step programs, which are inherently spiritual programs. And the other place is hospice care, when people are transitioning and crossing over. Those are two places where in medicine spirituality is not only accepted, but it's paramount and it's foundational to that practice of medicine. And you're exactly right, Cathy, that in cancer care that's not exactly the case.
Mhm.
And yet when people do introduce it, when doctors introduce it, when nurses introduce it, when programs and hospitals introduce it, it can make a huge impact in people's lives. And there's tons of studies to support this. And they support it in multiple ways. They support it by showing that the presence of a spiritual practice or spiritual beliefs, such as a meaning as to why difficult things happen, or life affirming beliefs, or anything that helps one to get through or to think about this in a productive, constructive way. Those are a lot of spiritual beliefs.
Mhm.
And that this helps people in terms of their survival, in terms of quality of life, in terms of getting into remission. And it shows, there's in studies going to church helps people heal, being able to have a God to look up to helps people heal, having spiritual communities or even social communities to be a part of, helps people to heal.
Mhm.
And so absolutely spirituality, I think in cases like this gives people so much.
If these emotions are not dealt with in this healing space between end of treatment and reintegration into life, will there always be a blockage there, do you think? Is this an area that we must pay a lot of attention to in order for survivors to flourish?
Um, I believe that people, to the best of their ability, should do as much to heal as much of themselves as possible, like through whatever challenges come up, cancer being one of them. And I actually, the people that I have helped to deal with cancer, I feel are doing precisely that. I feel like they're doing as much as they are able to do to heal physically, spiritually, emotionally, psychologically, and in every other way. And even in that healing, are parts left unhealed, or are there perhaps disavowed parts of oneself, or parts that we don't even know that haven't been healed, or things we haven't touched upon? Yes. And it's like life, right? It's like peeling layers of an onion that you go as deep as you can possibly go. And then when you have gone as far as you can go, that layer peels and you go deeper and you heal that. And then when you've done that, the layer deepens, you go to the next layer of the onion. And as long as you are alive, there are more and more layers to peel, because life is a constant growth process. And it's the process of life that'll show us the way in which we need to heal and when and how.
Yeah, I agree. And, it's not just healing from the actual diagnosis, from treatment. It's also healing. And someone brought this up. We'll get to this. I was just going through some of the comments. Um, as a person who has had cancer, and I had a lot of support, um, you can feel like a burden to people. And sometimes it's necessary to move beyond our support group, our family, to talk to people about this that don't have an emotional connection to us. Because, as someone mentioned, you can feel like a burden. And this is another emotional piece of it, shutting yourself down a little bit through a diagnosis. And to me, again, having a plan and incorporating people and understanding that you do need to deal with all different types of emotions. If we can educate people right today on that, and that there's no one way of dealing with things, there's no one type of emotion that we're talking about here. Any type of trauma has different levels, like you said. How important do you think it is for us to get somebody, if we're going through a cancer diagnosis, if we're approaching the end of treatment? Me personally, I would love to see the end of treatment be the beginning of that talk of therapy and talk through. How important do you think it is to get someone outside of your immediate support group to talk about what has happened?
Yeah, I think it's a beautiful thing if people are open to that and feel that they themselves can benefit from that. Absolutely. And there are people who I've treated who come after a cancer diagnosis and cancer treatment, and they're transformed. They're like, I'm a new person. I need to figure out now how to change my whole life
Mhm.
to match this new persona that I've recognized, or to get in touch deeper with this part of myself that through this experience.
Mhm.
And I want to read one of the comments. There's so many beautiful comments.
They really are.
Yeah, exactly. And so, Todd, thank you for sharing your comment. Todd wrote, "What if one like myself is at peace with the diagnosis, treatment, with little or no fear of the future and the unknown? What if we already believe my God and higher power has us exactly where He wants us? This is how I feel with little or no fear as a male breast cancer patient." And that's beautiful. And that is the truth as well, that people with deep spirituality, this happens to them. And this is the next thing. It's the next thing that life offers them, and they surrender and they move forward. And that is so beautiful. And it's from people like this that we can learn, and we can just see that it is possible. Oftentimes, oh, it says my internet's unstable. Can you guys hear me okay?
You froze a little bit. We hear you perfectly though. You're fine.
Okay, great. Yeah. So I feel that this is in a way where many of us want to go, to be able to live life without fear, from a place of surrender and knowing that we're going to be taken where we need to be taken. And what we need to do is live the best life possible and be as present as we can, and to do what is most meaningful and purposeful to us. And whether it's cancer or whatever else, everybody's going to get something. It's just life, right? It's just the nature of life. Then when that happens and you surrender and say, okay, I'm going to keep living the best life possible. I'm
Mhm.
going to keep doing what I need to do. And I'm going to, of course, deal with the challenges that I have to encounter and give myself the space to heal emotionally, psychologically, physically, socially, and in every other way.
I'm going to jump in here with a couple of questions and we'll start going through the comments because I think this is going to generate a lot of conversation here. And I don't want to get off topic from what people want to pull from this webinar. So let's dive in here. There's one question that I want to read to you, Anna. I've lost confidence in my body. I feel like it has let me down. How do I gain this confidence back again?
Mhm. Yeah, a lot of people will feel that. They'll feel that with
Mhm.
cancer. They'll feel that with anything that shocks them or creates fear within the body. And I think that there is a number of different things to do. That same body that let you down and in which cancer grew is also that same body that will heal you. And so I think first and foremost, expressing love for your body. Because of course, when this happens, we can get mad at our body, we can get mad at ourselves, at our habits. But what if we started to recultivate our relationship with our body, where we trusted our body, and that where we knew our body, together with our connection to a higher power, if this is part of our life, could heal and can get us to the next level. That's number one. The other thing is that a lot of trauma often is stored in the body. And if indeed the cancer and or the treatment was particularly traumatic with a lot of different treatments that had a lot of somatic and physical side effects, it might be useful to do some body-centered trauma therapy. And there are somatic therapies that can be done. And there's other therapies like EMDR and brain spotting, which I'm happy to talk about any of those, or EFT, which is tapping, which is where we release from our body certain things that the body can hold as trauma. And there's some beautiful books about this. One of them is by Dr. Vanderkolk called The Body Keeps Score.
Mhm.
And it talks about how we can release the different traumas that we store in our body and the ways to do that. And another one is called Waking the Tiger by Peter Levine. And so, two things. One, starting to cultivate love for the body and trusting your body again. And second, possibly doing some trauma work to release whatever trauma could be still stored in the body.
Wonderful. Another comment here. I often wonder if I buried my cancer diagnosis. I felt like dealing with the diagnosis was not as difficult as dealing with the grief of losing my husband from cancer. I am an oncology nurse and I am not sure if I approached it more like a clinician. What healing tools would you suggest I explore this aspect of my inner healing?
Mm-hmm. Yeah, so thank you for sharing that. That's a beautiful question. And I'm sure that approaching cancer as a clinician, doing what you needed to do from a medical standpoint, getting it done, that probably was a huge strength that you had and enabled you to get it done and maybe to some degree keep the emotions out of the way.
Mhm.
And that's a strength and that's okay. And now to process whatever emotions came up, I would encourage if you're open to it, to whether it be speaking to someone, whether to a therapist or dear friends of yours who really can hear what's going on inside, and then starting to do some journaling on your own and the questions that you journal on. And I would do stream of consciousness journaling where you just start writing and you don't stop, you don't hold back, you don't edit, you just go forward for say 5 minutes every day. And you write on what is it that I'm feeling deep inside. And if that question is difficult to write on, you write on the question, what do I most deeply want? And you see what comes up. And so you give yourself the space through stream of consciousness writing for the emotions to take hold, to come up, and for some of the unconscious things that maybe got buried as you went through in a very clinical manner. So just to reiterate, I think it was a strength that you did it that way. And now kind of to follow up, you can do a little bit of that emotional housekeeping if that feels right to you.
And this can take some time, right?
Mhm.
This can take time.
Absolutely.
It's a process, and sometimes we don't want to. We ask the question, but there's sometimes we don't want to actually dive deep enough for the answer. And as you say, it can be the peeling of layers and layers. I want everybody to be patient and forgiving to themselves. This is a very important piece. Be forgiving. It's central to your healing. as far as my opinion is. I've struggled, this is from Shirley, I've been struggling most with this new state of anxiety that was developed during treatment and missing, and missing my past carefree life, So there's again this
Mhm.
anxiety of, I guess, a weight,
Yeah,
a
yeah.
weight on you.
Wait, yes, yes. And so let's give you guys some statistics. So, according to the National Cancer Institute, up to 25% of cancer survivors experience symptoms of depression, and up to 45% experience anxiety. There's a lot of people experiencing anxiety.
Mhm.
Some also could experience some symptoms of post traumatic stress disorder. And, just with anything, if any kind of trauma, things go up: anxiety, depression, despair, suicide. There's the most concerning is that survivors of cancer are twice as likely to commit suicide as the general population. This is not just cancer. This is the case after any serious illness, after heart attacks and
Mhm.
things of that nature. And so, speaking about feeling anxiety, it makes a lot of sense. And so the question then is, we may not be able to return back to the so-called carefree life, but who can you be on the other side of this diagnosis that is more evolved and wiser than the person that you were before? And how can you live a life that perhaps was more meaningful than it was before, more full of gratitude, of wisdom, of having overcome and been through challenges, and therefore being able to take your experience and wisdom and share that with anybody else, either who's going through this or going through their own challenges?
I totally agree. Louise says there are things are not as they were. I know they are and will be better with time, but there is no going back to normal. I know it's not supposed to. It's an opportunity for change and deep reflection. It absolutely is. And Anna, when you mentioned telling your story, that's really what got me sort of off the fence about getting into the area that I'm in. I did, in small ways, start telling my story. And I tell all of my story for people who want to hear it. And I felt it was cathartic to me. It helped me to get rid of what I felt was embarrassing, that I allowed myself to get cancer and I didn't. To me, we all have weaknesses and they will manifest in different ways in our body. For me, it manifested in cancer. And these are learning experiences and these are life's situations that we have to deal with. I felt like a burden to my husband. This is from, and I totally agree with you, Deborah. I felt the same way. I felt like a burden to my husband and children. The worst part has been telling them it's spread again. Treatment is working, thanks be to God. And that's a beautiful outlook to have.
Absolutely. Absolutely right. And so I want to comment both on what Deborah shared and what Louise shared. So, Louise, I think it's beautiful that this has changed you, that you're not the same person, and that you have evolved to the other side. And I would love to hear. Louise is actually a dear friend of my husband and myself. And so I want to hear more about that. You're going to have to share that with us. And Deborah, I think feeling like a burden, especially to the people that support you most, I think that that is such a common thing for people to feel, as Cathy herself reiterated. And I think that this is often because women are used to being the caretakers. They're the givers. They're the matriarchs, the ones that sacrifice themselves for their families. I mean, if this is not the case in your case, I apologize. I don't want to generalize. I'm kind of giving the more generalized statement. And so women, by virtue of being the women who give or the people who give in the family, it's much harder to take. This is not just women per se, but this is anybody who is in a profession where they care for others. So this is also the case of all of my doctors, nurses, psychologists, and psychiatrists who I treat, who are so, so good at taking care of others, but much, not as good as asking for help for themselves when they need it. And so sometimes a challenge like this can come and it gives the opportunity to be able to be the receiver as opposed to always being the giver. So I encourage you the best of your ability to do that. And I hear you and I see where you're coming from in terms of your feeling.
Absolutely. Shirley said, I also explaining the mood swings to my kids because of the hormone therapy and dealing with the guilt of my short fuse. It's the same thing for me, but I turned it around and I said, you know what? This is my opportunity to get angry and blame it on the medication. So I would say to my kids, if I get angry, don't blame me, blame it on the medication. We all have different approaches to doing this. I think kids are so resilient, and I think kids are so intuitive to what's going on with us. You know, a lot of the comments, I feel guilt coming from the comments, and we have to shed that a little bit. This is not something that you cultivated that you should feel guilty about. And that's, again, that's my opinion from a non-therapeutic angle, but I don't think that guilt should be a part of the makeup of what you're going through. And I know it can be, but it doesn't serve you well. And it can be a hard thing to get over. But guilt should not be the one thing that the emotion that you should have the most difficulty with, I don't think. That's, what do you think about that, Anna?
Oh, 100%. And I also want to highlight what you just said regarding the two different narratives about hormonal imbalance causing mood swings. One narrative being, I feel so guilty and, this is me, versus this is medication that's being
Hmm.
used to treat my cancer that is causing this. Do not blame me. And so I think that this is also like our life essentially is the narrative that we create and construct. And so if we can reconstruct the narrative of our experience, of our side effect, of why we have cancer, of what this all means, to be more consistent with self love, self care, and self compassion, and less consistent with guilt, shame, fear, and trauma, then we benefit. And it's hard because our brains are hardwired and programmed into certain habitual pathways that, if something goes wrong in our life, we can blame ourselves or we can blame someone else or we can take on a victim mentality or there's all sorts of ways. And so this is also whenever these traumatic things happen, if they are indeed traumatic, because, as Todd had written, this was not traumatic for him. He felt like this is where he needed to be. This is where God put him and he was going to go forward and do what he needed to do to get to the other side. So that's a different narrative. But
Hmm.
if this is something that we ascribe the meaning of trauma to, as many of us do, then we want to see, is there a different way to look at it? Is there a different narrative? Which is why actually having a group like this or having other peers who are going through something like this can be so constructive because others will share how they're seeing things. And then you're like, oh, yeah, you know what? I like that. I'm going to try that on for size. I think I'll see things the way she sees things. I think I'm going to change my perspective to that.
Hmm.
And so here we are infecting each other with more evolved, higher consciousness ways of being and seeing.
And we don't have enough of these groups, and there is no right way, and there's no three-step solution to this. I think cultivating, as you're doing, Anna, and understanding that there are emotions that need to be dealt with on all different levels is the first step. Um, I want to read to you, Deborah said, spirituality is missing. If I didn't already have faith and trust God, I would not be living with hope. I've already had fear and despair. When the breast cancer met to my orbits, I promised myself that I would be joyful and dance every day. Some days it's difficult though, but that's a promise I keep to myself. And that's beautiful.
That's
That's
so
beautiful.
beautiful. That's really beautiful. I love that you're dancing every day. And I
Mhm.
encourage everybody to have some form of dancing, whether it be as someone else wrote in the chat about laughter, something where you are losing yourself and finding your joy and your childlike innocence again.
Mhm.
And for a lot of us, we're so in our heads, we're so cerebral, whether it be through work, through what we have to do, finding a way to not be that, to get out of our heads, to laugh, to joke, to do whatever we may not have been able to do before and to do so, within the confines of whatever life we have.
Mhm.
And the one other thing this makes me think of is one of the people who inspired me to become a psychiatrist was Dr. Irvin Yalom. And he worked with a lot of groups of individuals who had cancer diagnoses. He did that. He's a psychiatrist at Stanford. And he said that a percentage, I think he said about 20% of patients, if they're given a terminal cancer diagnosis, not just a cancer diagnosis, but a terminal cancer diagnosis for 20% of patients, something happens and something is lifted from them and they feel completely free in life, which I found to be absolutely fascinating. I'm like, how can this be? People are told they're going to die. Yes,
Mhm.
they are. And 20% of people with that, they suddenly have their freedom and could live whatever life they want to live. They don't care anymore. They don't care about having to people please, about having to, be who others expect them to be. they're able to align with their soul, live authentically, and do what they need to do. And that's a scary notion for many of us. What does it mean to live authentically? What does it mean to align with our souls? And that doesn't mean leave your family and jump on a plane to go to Thailand, not at all, but just to live more authentically and to live from a place of soul and replace any sort of fear that we have with whatever's on the other side of fear, whether it be
Mhm.
love, whether it be faith, whether it be joy, but the opposite of fear.
And cultivating this is going to be an ongoing thing. This isn't, it's going to be done in 3 months, it's taken care of. The emotions, just as life, we're going to evolve. There are going to be different emotions come up. There are going to be triggers. But having a strategy to work through this is important. Mary asked, is feeling guilty the same as having negative thoughts?
It could be a form of that, most definitely. I mean, you know, it's interesting, right? Because why could we feel guilty with cancer? We can feel guilty if we feel as though we brought this upon ourselves.
Mhm.
We feel as though we can't take care of our children or our family in the way that we would like to. We feel like we're a burden to our husband or our children or the caregivers. We feel like this might tax our family, economically. All those feelings of guilt. And that comes from, this like, I need to take care of everything. I need to be in control. I need to be the one, who is the caregiver. And so it's the caregiver profile that's most susceptible to guilt. And so what's on the other side of guilt? On the other side of guilt is I'm going to do the very best I can. And I'm going to give this my all. I'm going to ask for the help that I need and do my best now to receive. I can't give as much as I could before, but it's all right. It's my turn to take. And if it wasn't my turn to take, I wouldn't be here. This really is my turn to receive.
Asking for help has to be a very difficult thing for a lot of people. And I think if you can get to the point that you will accept help and ask for help, that is part of healing as well. That is part of
Absolutely.
healing as well.
Absolutely. Absolutely.
A lot
And
of yeah, a lot of us aren't in that position where if we're the caregivers, or if we're, people who come to webinars like this are looking for guidance and help and taking control. And oftentimes these are the people that will be the support of other people in a different situation. So when you're put in a position where you have to ask for help, you need help getting the kids to soccer, or you need help with meals, that can be very, very challenging. And that can be one of the first emotions, probably not the first ones, but that can be one of the tougher emotions to get through, is this feeling of, I do need help.
absolutely. Yes. And Deborah wrote that um, she felt that life needed to be disciplined. And indeed, right? Just getting the kids to soccer practice, etc. Discipline helps a great deal with life. And on the other side of discipline, because discipline I associate with very rational, methodical, in control, planning things out, very important to success in our society. The other side of that is going with the flow, being in the flow of life and letting life take you where it may, and being ready for the spontaneous, the unexpected, the difficult, and trusting the process of life. That for us is really, really, really hard. We would
Mhm.
much rather be disciplined and in control than to trust the process of life and surrender. I just actually finished a really, really good book on that. It's a book a few years old at this point by Michael Singer called The Surrender Experiment. And it's that question of how do we surrender to the deepest parts of ourselves whenever we've been challenged. And he does a beautiful job kind of exploring how he's done that throughout his life. And meditation was a really big part of his process. But for us, it's really that surrender process. It really comes down, it's between us and ourselves, or you can say it's between us and a higher power. That how do we surrender? And to realize that, whatever control we have, it's just a fraction because everybody's going to come upon things in life over which we don't have control. So, how
Mhm.
do we surrender to the flow of life in those situations and trust that process?
I'll give you a little tidbit of what I went through when I was first diagnosed. The first 2 weeks were very, very hard. I went through, why me? I thought I had done things right. I had the life of my family without me sort of already planned out. And I, at one point, I actually, to be perfectly frank, I went to church to get a blessing of the sick. And I still wasn't in that place of acceptance of what was going to happen and what I had and everything. But at one point I just said, I can't do this on my own. It was kind of like that Jesus take the wheel song. And for me, that's my spirituality. And everybody's spirituality can be completely different if it's a piece of your life. It was lifting for me to take it all off of my shoulders and say, there is a higher power that is in my life. And I felt that whatever was meant to be was going to be. I will fight the fight. I will do what I need to do, but I can't take it all on my shoulders. And it was like a breath of fresh air to me. And everyone has a different way of approaching these things. But I think if we can, like you have been saying over and over again, if we can find that higher power, it can be so liberating. I don't know if that's the right word that you would use, but it can be so helpful in this journey that we go through.
Absolutely. Absolutely. You know, when difficult things happen in our life, we have if we are a spiritual person, we have one of two choices. We either turn away from God because we're angry. How can this happen to me? Why do bad things happen to good people? I don't believe God did this to me. Or we get closer to God because we don't blame God for what happened. We just say, okay, this happened. God, please help me to get through it. And so it really comes down to being a choice of ours. But often many of us have to go through the process of being angry, of feeling betrayed by God, of feeling betrayed by life, by the world, only to realize that on the other side, there's actually more beauty. It's
Mhm.
interesting because people's happiness is not dependent on how healthy they are. It's actually dependent more on their perspective and what they've been through, what they've overcome in life. Oftentimes, people with no challenges, it's really easy to take things for granted. It's easy to develop attitudes like entitlement that unfortunately are antithetical to happiness. But it's through overcoming difficulty, getting to the other side, seeing that life does get better, seeing the miracles of life unfold when we surrender to life. That is often commensurate to people's happiness and well being.
We have a group and we're doing a happiness challenge right now, Anna. And happiness is cultivated. It really is a cultivated thing for most people. You have to work on your happiness. Deborah had a comment here. I thought life needed to be disciplined. How we think influences how we feel and respond. And that nails it perfectly. Our outlook, how we think, will really dictate if we're happy, if we can get through those emotional struggles.
Very much so. Very much so. Yeah.
And
And
go ahead.
I see other amazing comments. I'm
Yeah.
seeing the first comment by Louise here about, hold on 1 second. The comments just disappeared. Okay.
I'll read, let me read Lily's here if you can't
Yeah,
find yours.
yeah, and yeah.
One can die whole and healed without the curing of a disease. However, being cured doesn't equate to being healed and whole. And
That's powerful.
that's why we're here, right?
That's so
We've cultivated the physical, we've gone through the physical healing and we've gone through the physical processes of a cancer diagnosis, and that's part of it. We need to attend to the emotional piece. We
beautiful.
really do.
Yeah,
That was nice for sharing, Lily. Thank you.
absolutely. Thank you. Right. And Louise wrote, breast cancer has forced me to choose between life or the possibility of death, pleasing certain family members.
Mhm.
This was and still is hard to do. So this is one of those big things that happens, that to live your authentic truth and to live your truth. And who are you really and who are you living for? Are you living for yourself or all those people who want something from you, all of whom may want something totally different and have all sorts of opinions about how you should be living your life or what you should be doing? But at the end of the day, you're answering to yourself and your God. So
You need to be able to heal and cultivate your own happiness to be available to other people. And this is a big part of healing. Sorry, Maria just popped up here. Will this webinar be available so we can share it to fellow cancer survivors? Yes, we will be sending this out to everybody who registered. I know there are a few people who couldn't attend, but yes, this will be going out to everybody. So Thank you for asking that question. Does anybody else have any questions? I just want to be very mindful. Anna has an appointment at 4 o'clock, so we've got about 10 minutes to go. Very happy to answer any questions here on through. I think we have got to all the comments, right, Anna?
I think so too.
Perfect. So what are the first steps, Anna? What would you say to somebody now who's finished treatment? They are working through emotions. Where do we start?
Yeah, I think that the first step, if you are starting to do the healing space, as Cathy's talking about after treatment, starting to go back into your life, is to start to take an inventory. Who was I before this treatment and who am I now? How have I changed? What's changed in ways that I could see I have grown and become strengthened? And where do I feel a little bit wobbly and weaker? And what is it that I need? What kind of emotions are coming up that are difficult to feel? What kind of narratives do I have about why this happened to me or the meaning of this? To really start to get a sense of who am I now? Because there's, 20 people here and everybody has had a profoundly different experience. There's
Yes.
overlap for sure in your experiences, but everybody's experience ultimately is unique. And then to go deeper, I would encourage people to journal. And if you feel in your journaling or in certain emotional spaces you get stuck, I would so encourage you to reach out to consider therapy. I can certainly make recommendations. If you guys are in New York, you can contact me anytime. And to really start to see that this did not happen to me in vain. This happened to me for a profound reason and purpose. And there is no way that I am letting this happen without coming out on the other side a stronger, more fulfilled person. And now, what do I need to do to get there? How do I take the steps necessary and create the team, not just my cancer team, but my strengthening team, my mental health team, my fulfillment team, the team that's going to help take me to my next level in terms of all aspects of my life, my spiritual development, my growth, my emotional growth, my psychological strengthening.
That's beautiful, Anna. We just had one other question pop up here. How about a combination with homeopathy? So everyone will have their own team. I think homeopathy, if that works for you in combination with dealing with emotions, whatever speaks to you, that would be my opinion. What about you, Anna?
100%. I think that at the end of the day, people have to find what works for them. And that's the case with Western medicine or alternative therapies or a combination of the two. And everybody's treatment and healing protocols and procedures are very unique and really different. And so the most important thing is that you trust the people who you bring into your life to help you. And that you also check it out with your intuition, see how it feels to you. And if you have a good doctor, who's recommending things, you don't have to check it with your intuition. If your intuition is good for this doctor, then good, God bless. But absolutely, and 50% of people with cancer use some form of alternative treatment. So certainly homeopathy is well among them.
Wonderful. Okay, Anna, it's 3:53 and I know you have to jump. So I wanted to thank you so much for joining us. You're just so dear and so meaningful to me in my life. So thank you so much for joining us. Everybody, if you have any further questions, you can certainly email me. I'd be happy to provide you with Anna's contact information. We will be putting this out on YouTube. Anna will be getting all the details as well. So it will be sent out to everybody.
And I'll put my email into the chat. So if anybody wants to email me, they're very
Perfect.
welcome to.
Okay.
Thank you, everybody, so much
Thank you.
And Cathy for arranging this. And I wish you all the very best with your healing journeys, with your life, and with everything that your souls most deeply desire.
Thank you, Anna, and everybody. Further webinars we'll certainly keep you involved with, but thank you so much for joining us. I think it's a very important conversation to have. And Anna, again, thank you, and everybody. We'll talk to you soon and we'll be in communications with different things that we're planning. Take care.
Take care. Bye-bye.
Bye.